Hi, this is Craig Lane with the PowerPoint explanation for the blood sugar program part 2, starting on slide 9. In this slide, we talk about blood sugar helpful lifestyle. Again, this is part 2. There's no controversy in my world about a high carbohydrate versus low carbohydrate diet. What we want to do is test ourselves and have an experience so we start to see what our energy levels based on the parameters after we eat. We know how much carbohydrate we should be eating. So we can find ways through science to find this out, but I'm a fan also of subjective experience is so important. And our own experience is as important or more than any lab data. And I'm giving you an example. I have a couple of clients with kidney issues. The wife went in because she had amyloid or hardened mucus deposits or scar tissue that has disrupted and destroyed some of her kidney function. So her husband decided to get tested too because he's an ex-musician and drug user, and so he decided to try also. And lo and behold, his numbers look horrible, and yet he has no symptoms. He's symptom-free. Me, on my end, I'm well aware that you can be symptom-free up to losing about somewhere between 70 and 90% of that organ's function. But if someone is feeling relatively good, and the doctor states to him, I don't know how you're feeling as good as you are, you should be feeling rotten. Now, is that something a healer says to a potential client? No. That's demoralizing, and the man told me so. So our subjective experience is as important as the numbers. And that might ruffle some people's feathers, but I've had many cancer patients that are doing much better on my program, more energy, feeling much better, sleeping better, on the road to recovery. And one particular woman stands out with non-Hodgkin's lymphoma, stage 4. She was getting better. I have emails to prove from her own testimony she was feeling better. Then the oncologist basically tricked her and talked her into an experimental chemotherapy, and she died a month later. And I lost a heart patient years ago because his numbers didn't look good, even though he was feeling better. And I asked him, I said, would you rather die with good numbers or live a nice, healthy, good life with bad numbers? So numbers are often the body's ability to adapt to its circumstances. And in today's world, you're going to see some wacky numbers for some people. And we work backwards from there and ask ourselves, why are the numbers the way they are? Let's find a way to support this person, get them detoxed and tonified where we need to tone them up. So there is no debate in high carbohydrate versus low carbohydrate in my world. We find the optimal amount of carbohydrate scientifically, methodically, systematically, and then we adjust accordingly. Slide 10. So I firmly believe in this. Dr. Eades in his work, Protein Power, talks about this. And approximately 90% of illness results from carbohydrate metabolism and difficulty. I would tend to agree with that. You could go to Dr. Russell Blaylock's YouTube channel and find some good information there. RussellBlaylock, Russell Blaylock, MD. He wrote a book called Excitotoxins. And he's one of those guys that's non-apologetic. He's just stating the truth as he sees it. And he's an MD. So worth getting ourselves wakened up to the damaging effects of excess carbohydrate. Let me leave you with this on this slide 10 is there are essential fatty acids. We've got to have fat in our diet because we don't make them. We have essential amino acids. We've got to get them in our diet. Is there an essential carbohydrate? No. So that should tell you something right there. No essential carbohydrate. You can live quite a long, and maybe not for some people, in the metabolic typing system, which I deeply respect. You're able to find people that they're more the lower fat, lower protein, lower fat proteins, a little bit more carbohydrate in their way, and they often feel better. And that's great. But we're not talking high carbohydrate at all. We're talking normal carbohydrate, somewhere between 100 to maybe 200 grams a day, maybe more if they're doing heavy workouts. Slide 11. So you see this glycogen diagram on the bottom left here, and it's really telling to see all glycogen, or what starch is. Glycogen is the human starch. So when we eat muscle meat, we get glycogen that way because it's where it's stored. in the liver and stuff too. So when you eat liver, you get glycogen a little bit. But starches are long chains of sugar. So people suspect that I'm not eating sugar, so I'm not getting any sugar in my diet. Well, that's baloney. You're just getting a long chain of sugars, and the enzymes are what breaks them down and uses them for energy. And I have found the saying to be true that you eat more carbs, you crave more carbs. And it's very difficult to heal people, especially when they have infections and really bad immune problems if they won't drop their high carbohydrate lifestyle. Slide 12. The one thing that needs to be said here is we begin to get glycemic balance, and it's one of the foundations of the body. We must have the 4 foundations covered, which we'll talk about in the next slide. And who doesn't want to have better sleep? Who doesn't want to have better weight and appearance? And who doesn't want to have more energy? I mean, to me, the addiction to the other side, just like the alcoholic who knows he's got a problem but can't stop, that's where many of us are. I saw a cake last night. I went to a gathering called Consciousness Salon, and there was a cake there. Of course, I avoided it. Didn't even want it because I know people often admire me because, why you're not tempted by that? And I'm like, well, it's cost-benefit analysis, actually. If I get 10 minutes of pleasure from eating a piece of cake, and then I suffer for hours and hours and potentially 3 to 4 to 5 days, it's not worth it. And that's not at all. So ask yourself that question when you're thinking about indulging in something: is this worth some suffering down the road? And for most people, I hope you would answer no. Slide 13 talks about the foundations. You must be able to break down food and absorb it. You must be able to turn that food into energy. You must be able to break down the waste that's part of breaking down of food. And you must be able to break down and transform that waste. And you must be able to eliminate it. We call it a drainage protocol. And blood sugar regulation is included in those 3. So we have 4 foundations. And you cannot get to the bottom of any illness or disease state until we get those 4 straightened out. Hippocrates, way back in the day, the Greek physician, used to send people home on a very simple diet. I hear barley, soup, and vegetables, and I doubt that was the only thing he recommended, but I have a sense that he probably recommended a very simple diet, and he said to come back in a week or 2 weeks. And as the old physicians who walked around with their bags in the old country days here in the United States, one of their attitudes was, let's wait and see. And that's my attitude sometimes, is let's just wait and see. Let things blow over. We're going to have some acute reactions. That's what the body does. So let's not panic. Your final evaluation is very important because it gets you motivated to do more. So retake your questionnaires. Retake some photos if you can. Come into our office and get it done. You can always email me if you're doing this long distance, and I can show you email you some photos of the quality of what we're looking for. And I can also help you take exams with a practitioner in your area to take some of the tests that I need to help decide where to go after your cleanse, because 10 days for most people in our American lifestyle want it yesterday and want to fix everything quickly when we've taken a lifetime to get to where we are isn't going to work. We've got to think, for most of us, a year to 5 years of work. And it's not work, it's fun work, because you end up feeling better after just 2 to 4 weeks. And then you want to do more because you feel better. So get yourself evaluated properly. Where to go from here? Some great ideas. Establish some goals, some SMART goals, as we mentioned earlier. Establishing normal and higher standards. Understanding deprivation consciousness is really important, because when we can't have something or told that we shouldn't have something, the mind's going to want to grasp at it all the more. And once you see that and you can reframe it or flip it, like, oh, gee, I can't have these other 5,000 foods. I just can't have wheat, or I can't have this one. Then it's keeping ourselves focused on how good it feels to get the things we do want. And read the rest of that, and I'm open to any discussion there. And slide 16, here's our information at Health Alchemy. Please use us. We have a store. We ship. We see people 4 days a week. We have a community clinic. We have programs online. And we'll tailor what we need to you. And we also do consultations for practitioners. We also do consultations for physicians and hospitals if need be. And we also are willing to work with just about anyone under any health condition. And people ask me my specialty, and I say, give me the tough ones. Give me the cases that no one else wants or can do. I've got a number of them right now. And being a plant person, growing herbs and plants for 20 years, one of my favorite things to do is to pick a sick, dying plant and bring it back to life. And it's so gratifying. And that's how it is with people. Plants have intelligence, people have intelligence. We have brain chauvinism, as Stephen Herod Buhner puts it. We believe if he doesn't have a brain, it's not intelligent, and that's just untrue. Look at bacteria, look at trees, look at the earth. Everything's intelligent on some level. It's just that the way it's intelligent doesn't match up with our own conditioning and the way we think the world is and should be. So we have to go into another paradigm to see how this other intelligence works. Craig Lane signing off, healthalchemy.com. Our phone number at the office, 831-325-3174. Check out our other programs and YouTubes. We'll look forward to seeing you at some point in the near future.